Welcome, everyone. Thank you for joining us today for the evaluation of virtual care in response to COVID-19 webinar. I just wanted to ask everyone to follow the instructions sent to you yesterday to get ready to do the poll. So on the poll everywhere instructions that were circulated yesterday, or you can go to, I'll put it in the chat as well for anybody who's missing it, but if you can go ahead and pull up the page so you're ready, it is pollev.com/TaraMcFadden909. And then as we get to polls in the presentation, you'll be able to see what we're asking you. And now I'm going to hand it over to Purnima Sundar to get us rolling today.
Good afternoon, everyone. I want to thank you all for joining us today. We're really excited to share some of our recent work here at the Centre that we've done in partnership with our friends at Children's Mental Health Ontario, looking at virtual care and what's been working well, what's not been working well, and how do we move forward both through the rest of the pandemic and post-pandemic when we start to introduce virtual care as part of an ongoing suite of services. So I'd like to begin by acknowledging and recognizing the history, strengths, and diversity of Canada's First Nations, Inuit, and Métis communities. We're committed to engaging respectfully with Indigenous children, young people, and families within and across nations in what is known as Ontario. Ottawa, which is where we're located here today, is the traditional unceded territory of the Algonquin. And so, Tracy, I'm wondering if you're going to start up the slides, or if maybe I'm just not able to see them.
Nope, that's me.
Okay.
1 second here.
So I want to welcome you all, and I'm really, really pleased to introduce my colleagues, both from here at the Centre as well as at CMHO. First, I'd like to introduce you to Dr. Evangeline Danseco. Evangeline is our Senior Child and Youth Mental Health Researcher here at our Centre, and she's also a credentialed evaluator through the Canadian Evaluation Society. She's led various projects relating to evaluation and performance measurement here at the Centre, such as the training and development of data sharing agreements, relating to the business intelligence solution, and the evaluation of Good to Talk, which is the post-secondary helpline that provides supports to students in colleges and universities across the province. I'd also like to introduce you to Julia Kurzawa. Julia is a research coordinator here at our Centre and has coordinated the evaluation of various mental health initiatives, most recently the transition to virtual care in Ontario and a telephone counseling service for Arabic youth in Canada. And finally, I'd like to introduce you to Crystal Huang. Crystal is a policy advisor at Children's Mental Health Ontario, or CMHO. She leads and supports various projects with partners across the child and youth mental health sector and the healthcare system, including with us here at the Centre, to improve the quality and access to services for children, youth, and families across the province. So again, welcome to all of the presenters. And now that you know who's going to be sharing their intel with you today, I would like to also hear about what you all do, and we'll learn a bit about, a tiny bit about what you do in your organization. So I believe that some people are already starting to fill in the poll. We'd like to hear about what your role is, just so that as we move through the presentation, the speakers can sort of tailor what they share to our particular audience. So we've got researchers, managers, coordinators, policy analysts, advisors, crisis intake, lots of leaders, lots of managers and coordinators, supervisors, program service providers, people that work in suicide prevention, counseling, family therapy. So a really nice mix of representatives from across the province. So we're really eager to hear about your experiences, as well as share what many of you told us through our more formal evaluation. So if we shift to sort of what our agenda is today and what we're hoping to accomplish, Trace, can I get you to change that? Thank you. So we're going to start with a bit of an introduction. Evangeline, I'm going to very soon pass it over to Evangeline to lead us through the rest of the session. She's going to share the results of the study. And then we'd like to also reflect on those results and hear from you, as I said, also take some questions, provide some responses, and so on as we round out our time here today. So just in terms of how we came to be focusing on this particular topic, just a tiny bit of history. Early on in the pandemic, it became really clear that while there were many organizations across the province that are already providing or were already providing virtual care, many were taking this on as a new endeavor in their agencies. So with the introduction of COVID-19 and all of the different safety precautions that needed to be observed early on during the lockdown period, agencies pivoted very quickly to delivering virtual counseling and support services through a number of different modalities. So a number of different platforms, also through text and chat. And so what we wanted to do in a conversation with Kim Moran early on, we were talking about how this is really a remarkable shift that the sector has made. And we knew that over time, now that we all have become more comfortable with virtual care, and interacting virtually, this isn't going anywhere. So there is really, a great opportunity for us to understand what worked well and what didn't work so well, so that as we move towards ensuring that virtual care is part of our service offerings across the province to the families and children who may benefit from it, we wanted to make sure that we're implementing with care and implementing with evidence about what's working and what's not working well. So maybe with that history, I'll flip it over to Evangeline, and I will reconnect with you all at the end of the webinar to moderate the Q&A portion. Over to you, Evangeline.
Hi, good afternoon to everyone, and happy to be here. Before we proceed, I just wanted to also acknowledge the contributions and the valuable input of our advisory committee members, which would include Greg Lubimiv, Kathy Sedeo-Jarvie, Fred Schmidt, Camille Santa Fe, who's our youth advisor at the center, and Natalie Markov, our family engagement specialist. So as Purnima was mentioning, in the next slide, you'll see how we were moving quite fairly rapidly, just to match also all the rapid shifts that the agencies were doing to respond to COVID-19. We put together our evaluation framework, ethics approval, collected data, did the analysis, and now showing you our results. So the objective of our evaluation, because we wanted to look at things at the provincial level, we wanted to get a range of what's happening across all the agencies in Ontario, and then also identify what were the experiences of service providers. And we wanted to understand as well how youth and families have been experiencing the transition. And for all this, we wanted to be able to identify the potential knowledge and resource needs, as Purnima mentioned, for the longer term implementation of virtual care. During this long process of the pandemic and post-pandemic. At the outset, we did define virtual care as the delivery of services using telecommunication technology. And it's around communicating with clients in real time, what we call synchronous services. And towards the process of chatting, of connecting with service providers and agency leads, this was actually integrated also with not just the video conference, but also with phone, with texting, and with apps and emails. So one of the first things before actually delving into our methods, we did consult with the literature, and there were two frameworks that helped us identify the areas that we would be examining. The consolidated framework for implementation research was, it's been researched for almost 10 years now, and they have a wiki page. So for those who are interested in developing their questions and identifying what areas they want to examine, this is a highly recommended framework because they provide a lot of tools and resources. And the second framework was a little bit more complicated. In the next slide, you'll see the next framework called, it's even complicated, the adoption, non-adoption, abandonment, spread, scale up, and sustainability of patient-facing health and healthcare technologies. And I would say the addition of this would be looking at the complexity of the mental health condition and also the adaptation over time. So given this, we used a mixed methods approach. We actually we issued a survey to 166 or so agencies in our sector, and there were 97 who responded. And we interviewed the agency leads. I think it was around June 17 to around mid-July. We did our focus groups and interviews for service providers. I think the last week of June. We didn't have a lot, particularly from the Toronto region, but we did have saturation in terms of the themes. And we heard from 192 youth and families from across the province. So I'll pass it on now to Julia, who will talk more in detail about the results.
All right, so I'm going to be discussing a brief kind of review of the results in general, starting with how agencies and service providers prepared to deliver virtual care. So what we saw with agency leads was that there was a number of steps that folks took in preparation of delivering these services. Often there was some type of needs assessment, so determining what types of technology or resources would be required to deliver these services, selecting an appropriate platform or a few platforms that they're going to use, revise and develop policies, so looking to professional organizations and what they recommended, developing or revising, say, work from home policies or privacy and confidentiality policies, looking at workflows and if there was a way to make that more streamlined as well, providing training to staff in terms of technology, as well as in terms of, how do you provide the evidence-based care when you're doing it virtually, and then some type of reflection, evaluation, and improvement. So surveys potentially to clients or staff, other types of evaluation activities. From the service provider lens, we can see that parallel. So they were familiarizing themselves with the policies and procedures, obtaining the right equipment, taking part in the training, coaching clients, and also problem solving with others. Then if we move to service providers in terms of with clients, so that we saw that they were learning alongside clients, so learning alongside them about the platform, these new routines, new safety protocols, as well as just ongoing problem solving. So in terms of costs and resources, folks definitely spoke to licensing and software being one of the main costs, as well as hardware for staff. So making sure that they had an up-to-date laptop or phone that would allow them to participate in virtual services, potentially phone plans or top-ups, both for staff and clients, as well as the staff time needed to create those new policies to get trained. IT support for some of the smaller organizations that didn't have this in-house was an additional cost. So now I'm going to move to how agencies and service providers and clients actually experience the transition to virtual care. So first, if we just look at what types of services they were providing, again, this is July, so early on, still in the pandemic, we see the majority were providing counseling and therapy, brief services, family capacity building, and then we have quite a few others there as well. So quite a range of different services that were being provided. In terms of the benefits of virtual care, many of the stakeholders just naturally kind of spoke to this and said, it had the possibility for expanded geographic reach. So as an example, groups that were previously held in different geographic areas were sometimes combined now that they were in virtual. Increased convenience, both for staff and for clients, so time and cost savings, as well as enhanced engagement and comfort for some clients. And we saw that through the family and youth surveys. So in terms of the facilitators for that successful shift to virtual care, I don't think it's too unsurprising what we picked up on. So having the necessary resources, having the training materials, having very engaged staff, and it helped if they were really focused on that client-centered care. So what would be the best kind of situation, what would work best for clients. Previous experience and relationships with the client, so it was a bit easier if they had that kind of established trust and rapport already. Leadership support, and then an overall kind of collaborative approach where folks worked closely together to problem solve. So in terms of challenges as well as the mitigation strategies, this was a big area of discussion, and definitely one that came through quite clearly was accessibility, and in particular in relation to internet connection, as well as the resources or the kind of software needed to participate. So some of the strategies that folks used to try and get around this was doing other kinds of engagement approaches. So some had talked about even porch drop-off, so dropping off resources that clients could then use, some workbooks, offering more flexible services so they could participate by phone if internet was an issue, and then partnering with community agencies in order to provide some of those physical resources, you know, tablets, that sort of thing. Privacy and safety concerns. Often the way this was addressed was by establishing those safety protocols. So, you know, having clients explain where they are, you know, are they taking the call from a park or are they at home, and offering flexible services. So using more chat functions, certainly for youth who were at home and potentially didn't feel comfortable kind of saying that out loud. In terms of the next challenge, this is around establishing or maintaining trust, and I just spoke to that in the facilitators as well. So when that relationship wasn't previously developed, so with new clients, this was a particular challenge. And one of the strategies mentioned was just to check in more frequently and try and kind of build that relationship over time. Ensuring fidelity to evidence-based protocols was another one. And really, we saw folks just sharing resources, trying to problem solve as they went, looking to the literature, having a bit of that kind of research lens as well. And then the kind of blurred lines between home and work. So I'm sure this is one that many are familiar with, but this was definitely a challenge that was mentioned. And strategies that organizations used was really placing more emphasis on self-care, encouraging staff to take more breaks, more check-ins, etc. And we'll speak to this in recommendations as well. And then conducting sessions with younger children as well as groups. So again, something I'm sure that you're familiar with, you know, how this could be a bit more challenging virtually. And so they were often doing shorter sessions, more frequent sessions, potentially having several facilitators for groups. And so, you know, one would be the main moderator, another would moderate the chat, as well as providing workshops for parents and working closely with parents. So at this point, I'm going to just stop here and ask, does this resonate with you? So are these challenges that you have experienced or that you're aware of? Okay, it looks like it does. So that's great to hear. And so we'll go to the next slide and just ask, what are some of those challenges? So what are some of the particular challenges? Are they the same ones that we went over? Are there different ones? So we're just anxious to hear from you. Just the general transition to virtual care as being one. Using multiple platforms, yes. And I can see that for sure. Clients also spoke to that, you know, trying out and using different platforms. So potentially not as many challenges if folks were already offering virtual care, having a bit more kind of time and training. Yes, definitely rural and remote and internet trouble with that we heard as well. Finding resources that can be used virtually. Okay, and the same kind of things that are discussed. Access to internet, again, a big one. So you'll see in the recommendations, we're gonna talk about that one as well. Yep, privacy concerns, access. So many of the same things. So that's great to hear that Mm-hmm. Yeah, and some preference, client preference for it. Okay. So we'll continue on and we'll be able to continue this discussion throughout as well. So in terms of clients' experiences, so just shifting to that client experience, we see largely positive. So about 83 said the technology was easy to use. They felt quite confident in what to do after the session, had a better plan for how to handle their concern, and intended to continue to use services. So largely positive again. So we kind of explored that further. What we saw is that they cited many of the same things as staff, so more convenient, more comfortable, time and cost savings. They didn't have to travel to appointments. And really their recommendations also echoed the challenges that we heard. So yep, internet connection being a big one. So suggesting that we have some way to improve that, ensuring privacy. Again, I spoke a little to that in terms of you know, now children and youth were in the same home as parents and siblings, and maybe that was more of an issue than in person. Some asking for increased check-ins, and then some who had multiple providers were just asking for improvements around the communication between providers, but also that multiple platform piece that did come up as well if they had different providers and had to learn different platforms. So in terms of no-shows and equity considerations, this is something we also spent some time on, really exploring with agency leads and what they had observed in terms of the reason for no-shows. So there was some reference to reduced client need. Now remember, this took place in July, so school was largely not in session. So there was some reduction for kids who had a lot of social anxiety, or a lot of that anxiety came from school. Some client preference for in-person, lack of access. So we see this access issue coming up again, and you'll see this in recommendations as well. And then just other issues that are related to social determinants of health, competing demands and family instability, just those issues that might make it more difficult for children and youth to participate virtually. So now I'm just going to pass it over to Evangeline again to reflect on these results.
Yes, so when reflecting on the results, some of the agencies provided us with some ideas in terms of how they're evaluating the shift to virtual care. And again, this was pretty early on, back in July. And so some of them were really just starting to do their evaluation and think about the evaluation. So they were talking about having client and staff surveys, looking at who's not showing up, any movement in terms of their wait list, or was it growing as well, and the issue of people opting out of services and just deciding to come back on when for the fall, presumably when the services would resume. And some of them also started to begin their clinical supervision, the quality assurance relating to recording some of the sessions. And there were constant check-ins with staff at team meetings, and this became opportunities for working on challenges, identifying solutions, and for service providers, just having those quick check-ins at the beginning and at the end of their sessions. Early on, around April, May, we did develop a framework for evaluating and for implementing e-mental health services. And so we identified there some areas for looking at clinical outcomes, and these are some of the areas that you can evaluate. So for example, getting feedback from the clinicians about the appropriateness of virtual services and any safety concerns that they have. And we saw that during, from the focus groups, where service providers, even when it's just a small screen, they would be able to identify that actually this situation is not that safe, and they would monitor the safety of clients. some information about collecting client feedback on goal attainment. As well, there's a new checklist from Project ECHO and CMHO called the Virtual Care Checklist, I believe. And connect with me if you want further information about that checklist. And also just comparing the outcomes for face-to-face visits versus those with virtual care. And in terms of client engagement and satisfaction, as usual, it's looking at the therapeutic alliance and client perception of care. There's a lot of literature showing that the therapeutic alliance actually remains quite strong, but I think a lot of those studies have been done with older youth or more with adults. So we still need data, I think, for child and youth services. And the virtual care checklist from CMHO and Project ECHO would include also some of these areas around usability, the usefulness, the intention to use, and the readiness to use. And then other areas to evaluate, and again, this is informed by the CIFR model and the NAS framework. You look at the staff training. Some of this might be through formal surveys or quick asking staff. For example, tell us one word about how you felt after this training or after this meeting. And it can be gathering some of those success stories and tips, especially. So I guess we wanted to know from you, what were some kinds of evaluation activities or the opportunities for reflection that you have been able to put in place in your agency, especially now that you've been able to provide the services and then move to reopening, having re-entry, and then now exploring virtual care for other types of services. Okay, so we have some live polling during groups and workshops. Great, some evaluation of client and clinician virtual care surveys. Great, another survey might be good even for us potentially to pull and see what are those surveys that you're sending out so others who haven't done those surveys can learn from your experience. Oh, Mentimeter during training. That's a new one. Virtual. Yes, and sometimes it's just leveraging the surveys that you already have and you just add one or two more questions around the virtual care. Great. So these are excellent examples. We can collate all this and be able to share with you, as well as share the resource I mentioned about the virtual care checklist. So we'll move on now to Crystal for the recommendations.
Thanks very much, Evangeline. So as you can tell from the pandemic, agencies have really had to shift quickly to providing virtual mental health services where possible, just so they can limit the disruption to the treatment that kids and families were receiving. And what we heard from agency leads and service providers throughout our research is that they were really learning as they went, from looking for the right virtual platform to use, revising their workflows and policies, making sure staff felt supported, but that clients were also still having a really positive experience with their treatment. It was just a whole variety of considerations that organizations really had to make as they were rolling out virtual care. But even though there are a lot of these challenges that we heard about, it was also very clear to us that the pivot to virtual care has really been positive for both clients and staff. And so much so that a lot of organizations do want to continue to provide virtual care on an ongoing basis, within the context of the pandemic, but also beyond that. So based on what we heard from agencies, we developed some recommendations and considerations for how you as executives, service providers, managers can integrate and expand virtual care in your organizations. So because of the positive experiences that we've heard from agency leads, service providers, and clients, one of our top recommendations is definitely for agencies to consider offering virtual care as a part of your menu of services. And we know that the appropriateness and effectiveness of virtual care will depend on factors like the complexity of the mental health concerns, the efficacy of the intervention that's being provided virtually, and even some of those privacy and access issues. And we've also heard that while some service providers and clients do prefer and do really enjoy having access to virtual care, there's still others that would rather do in-person or want a combination of both. But what's important here as a part of offering virtual care among your suite of services is consultation with the staff and consultation with clients, just to see how virtual care can be offered given what services you already have and level of need of your clients, so that virtual care just becomes an option for those that do want it. Our second recommendation here is to consider accessibility of the virtual care that you're offering. So in order for virtual care to be viable and equitable, it needs to be accessible. And we've heard that the most common issues were internet connectivity and also the cost, both of internet access and technological devices. So this is a super important consideration, considering that those in rural, remote areas where, for example, internet connection commonly creates access issues, those individuals also already have limited access to mental health services in general, and yet virtual care is meant to allow service providers to really reach those that are normally hard to reach. So thinking about ways for how to improve accessibility of virtual care will be super important as you think about how to provide that in your organization. And what we heard from organizations is that they were able to, if they had the resources to do so, provide clients with internet sticks or top-up plans for phone and data. Where that wasn't always possible, we've heard that community organization partnerships were also really helpful, just so different organizations within a community can share the cost of those resources that clients need in order to be able to access virtual care as an option. Our third recommendation is to consider how best to engage a greater number of children, youth, and families from different communities, different backgrounds. So while agencies have made efforts to identify and address some of those barriers to engagement, we are seeing that not all children and not all families are engaging in virtual care or choosing virtual care as an option, even when it's available to them. And so this is super important for us to think about, knowing that mental health needs are going to continue to rise throughout the pandemic, and thinking about how we can use virtual care to reach those kids that are hard to reach. So as you think about how virtual care can be best integrated in your organization, it may be helpful to consistently monitor how kids and families from different backgrounds and with different needs are reacting to the option of virtual care, just so you could adapt and modify the way virtual care is designed and offered from your organization. Our fourth recommendation, enhancing staff training and supporting knowledge exchange. So initially, agencies were providing staff with just really basic training just to get the virtual care running out of their organizations. But as we're seeing that it's becoming a norm, there's a need for more advanced training focused on specific types of therapy and population groups to make sure that staff have the skills and competencies they need to provide different types of treatment, different types of care using the virtual care method. So some options for how You can encourage or implement staff training. Could be having an expert come into your organization and providing training, or perhaps having an expert that provides training to several organizations within a particular community or a particular area. Communities of practice are not uncommon in our sector, so perhaps creating one specifically for virtual care in order to support peer-to-peer knowledge exchange and just sharing different innovations and best practices across our sector. But definitely as we continue to learn more about how, when, and for whom virtual care works and doesn't work, how we can best fit virtual care within our existing services, it's important for us to think about what opportunities there are for us to share questions, answers, and best practices. Our fifth recommendation is promoting staff wellness and preventing fatigue that staff may be experiencing from delivering virtual care. So, we've heard from service providers how fatigued they were at a pace of change, particularly at the beginning of the pandemic. Staff having to balance personal responsibilities with work, and just the additional energy that's required to conduct virtual sessions, which is so different from the energy spent on in-person services. So to prevent burnout and maintain staff wellness and morale, it'll be important to think about perhaps reevaluating caseloads between staff, how many clients they see in person versus how many they see virtually. Maybe they see a different number of clients per day depending on how they're offering those services. Planning periodic wellness activities for staff, encouraging them to take frequent breaks throughout the day, encouraging them to engage in self-care activities, just really putting their wellness at the forefront as well, because if they're not feeling well, it's very difficult for them to provide clients the support that clients need. And lastly, our sixth recommendation is to provide system-level guidance and oversight on quality. So this recommendation is perhaps more directed at what needs to be done for our sector as a whole, particularly given what we've heard from agency leads about how they felt like they were navigating this transition to virtual care alone. So what's important as we move forward here, I think it's for agencies to undertake some quality improvement and evaluation activities on virtual care within their organizations. And this can begin with using the evaluation framework and checklists we've developed that Evangeline was talking about earlier. And this information that gets collected from each organization can really feed well into the development of sector-wide guidelines and best practices for delivery and for quality that system leaders can be responsible for. But ultimately, the data collected by agencies on outcomes such as safety, effectiveness, efficiency, experience for the client and for the service provider, equity, all of this information would just really, really well into how system leaders can make data-informed decisions about quality and integration of virtual care, and then also using that information to create guidelines for the sector on how we can best deliver virtual care moving forward. So these recommendations are mostly targeted at how virtual care can be operationalized and integrated at the organization level. But what's important here is that these recommendations can also help us move forward in terms of how we look at the delivery of virtual care more broadly in our sector, and then how we can begin to think about quality and consistency of virtual care as the virtual care option becomes more common. So we have one last poll here for you. We just want to know from you whether you think these recommendations are actionable in your organizations. Just considering, do you think these recommendations are too general, or do they give you enough space and flexibility to adjust based on what your organization's needs are? Okay, so I've seen mostly yes, which sounds good. That's very promising for us as well. Okay, great. So I'll pass it back to Purnima for our Q&A.
Great. Thanks very much, Crystal. And thanks very much to all three of you for a really terrific presentation. I've heard that presentation a few different times, and every time I do learn something new. So it's really nice to be able to be part of this in an ongoing kind of way. So we do have some questions. And so I would encourage folks to continue to put your questions in the chat. You can send them to everyone, or you can send them directly to Tracy, and she'll feed them to us as they come in. So first question. Did you, the presenters, did you look at what the new safety or risk indicators that staff should be aware of in delivering virtual care? Did this come up at all throughout your research? Did people flag this as an issue? Safety and risk indicators.
Yeah, so we asked agencies about what were the steps that they did to prepare to deliver virtual care. And I would say 100% all agencies looked at what were the safety considerations, privacy, right? Like even in terms of their professional competence requirements through the professional bodies. And then the next step was trying to apply it to their local level, to their agency, or to the work with other agencies potentially, but definitely that was the #1 concern. Even in the selection of the platform, safety was #1. In terms of the challenges, that was #1. So yes, very much the focus is around safety, not just of the platform itself and the privacy around that, but the safety of the surroundings where clients are, where staff are actually in terms of their physical location, having safety protocols, for example, in the event that something happens. So safety was definitely a big topic.
That's great. Thanks, Evangeline. And I'll just let folks know as well that we've been doing some work to build capacity across the sector in this area. And so if you visit our website at cymh.ca, the opening page will take you to all of our COVID-related resources, and there are a number there. And if you go to the tab specifically that focuses on virtual service delivery, there is there's a summary about the different platforms and also how, how each of them does in terms of safety and privacy. There's also a Virtual Care 101, and in the Virtual Care 101, if you don't want to actually watch the entire webinar, there are questions. There's a Q&A document that goes that accompanies this, and there are some questions there that address issues related specifically to privacy and confidentiality. We are also in the process of pulling together a webinar looking at how do you deliver high-risk care. So when you have young people and families with very complex needs and very high levels of risk, how do you provide really deep care virtually in that kind of setting, one that addresses issues but also keeps people safe throughout the process. So thanks very much for that, Evangeline. Next question, is there a difference in the therapeutic skills that are required in delivering mental health care?
I think,
so is there a difference?
Yeah, I think the verdict is still out for that. So our evaluation did not look at the training per se and the competency, but definitely one of the areas that was brought up. And people were doing different types of training. So sometimes just one-off, or sometimes asking a prominent speaker to come and speak to all their staff. So it's still quite spotty in terms of the training. And
okay,
I would
great.
say even the literature is still not as robust as we want them to be for our sector.
Okay, great. Thanks, Evangeline. The next question is asking about the recommendations that came from the report. Specifically, Sean F. would like to know if we could flush out recommendation 6 a bit more. So can you speak a little bit more about the background, what it was that led to that recommendation? That recommendation is provide system level guidance and oversight to ensure high quality virtual care.
Mm-hmm. I think because we were, again, the caveat that we were speaking to the agency lead service providers early on in the pandemic. And so people were doing things quite separately. So there were some agencies that had already started to look and monitor the quality of care. They were monitoring who were the no-shows. One agency, for example, did an exhaustive calling of all the clients just to make sure what types of formats would they want to be able to continue with their services, either by phone or virtual, like for all clients, and did this systematic assessment of client needs. There was also, I think, some inconsistencies in terms of, say, the training sessions. So this recommendation is actually more to be able to have just more consistency across all the different agencies. So we're not also duplicating sometimes some of the efforts that one agency may have developed a guideline about how to run groups. So it might be good for us to build on that and to be able to ensure also that we're doing something similar.
I think this is a great, thanks about, sorry, go ahead, Evangeline.
Well, I was going to add as well that so prior to COVID-19, the center had already identified that digital mental health would be one of our focus areas. And we assembled a group, an advisory group, and we are developing guidelines for implementing virtual care. And I think from the work of that group, that we're also identifying the need for just consistency in how walk-in virtually can be done, or how to build the ongoing capacity of staff, just so we're all on the same page.
That's great. And just to sort of add a bit more to what Evangeline said, this draft guideline is going to be probably ready early in the new year, and we look to finalize it for early in the new fiscal year. So we'll be rolling that out, and we have a plan to do that. So stay tuned for more information on that in coming months. The next question is from Janice, who asks, virtual care is not successful for many youth who present issues such as trauma. Did you look at what types of presenting problems are not good for virtual care?
Yeah, so this was a question actually that we asked also our service providers. And again, they didn't really show us their data, or they're still in the early stages of gathering this data, but definitely I think this is one of the million-dollar question. And from the frameworks, for example, from the NAS framework, from primary care, we know that the success or the technological innovation will really depend on the complexity of the mental health condition. So we talked, a lot of them hadn't even started. A lot of them hadn't even started running groups, for example. And a lot of them were just working with more maybe moderate or with those with mild mental health needs. But they needed, whenever there's someone with some needs, whether it's high risk or not, before the protocol would be, well, no, you don't conduct virtual care, it has to be in person. But because of the limitations, it's more the ethical consideration as well, that we just have to provide service in whatever form. And so I think there's still a lot of research that needs to be conducted in terms of the severity of the conditions and the group format. So we're still I think as a sector, that's still something that is currently being developed. And I think we're also working on developing some of the, or trying to identify what does the literature say about how to run groups virtually.
So just to add, in terms of timelines for that particular evidence brief, our team is currently working on it, and we're hoping to have something finalized before in the next month or so. So we'll be able to share at least high-level findings with folks around how to deliver virtual care. And you know, going back to that issue of system-level guidance, I think all of these questions provide an opportunity for us to really bring together what the evidence has to say about all of these issues and provide that provincial-level guidance. The next question is from Mamta. Mamta is wondering about the effectiveness of delivering different treatment modalities virtually. So the concern is that, you know, by altering the treatment modality to a virtual sort of setting, how does that impact treatment outcomes?
That's one of our recommendations too, Mamta. Is to try to identify and examine what are the differences when an evidence-based practice, for example, gets modified and there's a virtual component rather than in-person. What we've heard from some of the providers was that they had to plan ahead, make sure they had a lot of the resources available electronically rather than just in paper pencil. Sometimes having, so I think just planning ahead, but those are not really documented and not studied. So definitely again, I hate to say more research is needed, but those are the gaps in terms of our own understanding of where and how it works.
So I think that's, you know, really another important resource that is on our website was developed by Evangeline very early on in the pandemic when people were shifting to virtual care, and its guidelines. I think Evangeline, you might have mentioned this earlier on in the presentation, but a series of guidelines for as you embark on delivering virtual care in your agency, what are the things that you want to be paying attention to as you evaluate the effectiveness of the service, as well as the impact on treatment outcomes. And so I'd encourage you to go to our website again at cymh.ca and check out that resource there as well. And you know, again, another opportunity for us to perhaps provide some system level guidance by ensuring that people are measuring the same kinds of things when they're looking at treatment outcomes. So it looks like our questions have slowed down considerably. Maybe I'll give people just a couple more minutes before I shift back to Tracy to close us out.
Yeah, no, I appreciate so much your questions. And I think one of the things also that obviously we couldn't say everything that we found in the report, but that we asked respondents about what were they surprised about. And one of the surprises really was that staff were just 100% really engaged. Clients were also very much engaged. So just being able to embrace virtual care at that time was really something quite positive and something of a surprise. So even staff who were probably a bit hesitant to be able to use virtual care realized that, oh, it's not so bad after all. Then of course, yeah, it can be exhausting, but in terms of the delivery of virtual care and being able to actually still establish the semblance of a therapeutic relationship, they were quite surprised.
That's great. So it looks like that's it for the Q&A period. Maybe I'll flip it back to, I guess this is my slide. The next steps, as Evangeline said, is that we would encourage you to have a look at our final report. It's currently being finalized and will be up on our website, Evangeline.
Soon? Maybe in 1 or 2 weeks. Yeah, very soon.
Okay. And so you'll get a notification if you subscribe to our field notes, you'll get a notification about that. If you don't subscribe to field notes, we'd encourage you to do so. But you'll also be able to see it on our website at any point over the next few weeks. And then we'd like to be able to follow up with a second webinar, and we'd like to be able to feature some of the organizations that are currently doing virtual care, who have shown some promising practices or promising evidence to support the way that they're delivering care. So please look out for more information on that as well. Again, I'll just put in one final plug for our website. If you want to check out our COVID resources, there are a number of them there. I think we're at 13, 14, 15, something like that. All of these have been developed in collaboration with our partners at CMHO. And there are a whole slew of resources there specifically focused on virtual care. So I'd encourage you to have a look at that. And I will flip it back to Tracy. Thanks very much, folks. I'll flip it back to Tracy to close us out.
Well, thank you. I don't have a ton to say to close us up, other than to say thank you for joining us. And in about 15, 20 minutes or so, you should expect to see a SurveyMonkey link in your inbox, just asking what you thought about today's webinar, to give us any feedback on how we can improve, and also to ask you on any topics that you would be interested about hearing some more on in the future. So stay tuned for that, and we'd love to get your responses. And I think I'll just turn it over to Evangeline, Julia, and Crystal for any final words.
Thank you once again. And yes, we will send out the slides and any resources that we mentioned. If you're not in field notes, we'll send also a copy of the links to the report to the attendees. And if you know, or if your agency has done an amazing evaluation of your virtual care services, please connect with us.